the treatment for aortic valve disease, if you would, encompasses replacement of the valve in majority of the time. Now, in children that are still growing, that are born with congenital aortic valve disease, then we tend not to replace them because the children grow and the valves don't. So there's a heavy emphasis on repairing those valves for the babies. Now, in adults that acquire valve disease, either because they're born with a valve that is not fully developed, and they get into trouble when they're in their 50s and 60s, then the treatment is still replacing that valve, because now the adult has done its growing, the heart is not going to grow anymore, and a replacement of the valve is quite effective. Now, over the years, we have refined what works and what doesn't, and this has gone through quite a bit of revisions. But over the last 10 years or so, we are replacing the valves in patients that are in their 40s and 50s with mechanical valves that are going to last forever. But once they reach their 60s, then we again replace those valves, except that this time we replace them with tissue valves. And tissue valves have a benefit of not requiring any Coumadin, but they don't last as long, meaning that if you replace an aortic valve with a tissue valve for a patient that's in their 60s, the valves are going to last about 10 to 15 years. So by the time they reach 80, then there's a possibility that we have to revisit, the valve disease there. But it is becoming standard of care that for people over 65, we change the valve with a tissue valve, and for people that are under 65 or so, or 60, we change the valve with a mechanical valve.